Take a minute, open your eyes. It's time to see it, realize that's how they're living, how they get by. They try to fight it, but there's no end in sight. But we all have the chance to give more than just a glance and let them know that there is something more.
Faces. Faces of need. So many faces. Each one so special. Each one so different. Faces of youth. Faces of life's years. Faces of desperation. Faces of hope. Faces of hunger. Faces of contentment. Faces of loneliness. Faces of togetherness and fellowship. Faces of physical need. Faces of wellness. Faces. Faces of need. At the Council on Aging, we are about faces. Faces of need. Each one different. Each one special. We envision a community without hunger, without sickness, without homelessness, without isolation. We envision a community where each individual is empowered and equipped to achieve as they were intended to. We envision a community where compassion and respect for each other is expressed in the belief that investing in human potential gives one the capacity to excel and to shape one's own path.
We all join hands to make a way. We all join hands to make a way. We all join hands to make a way. We all join hands to make a way.
Alzheimer's disease is one of the most heartbreaking and burdensome diseases our community currently faces. Its life-transforming effects touch families and caregivers in ways not typically known by the general public. Alzheimer's and other dementias like Lewy body dementia impact our healthcare system as a whole, and specifically the organizations that step up to help those in need.
My husband David and I have been married for nearly 46 years. He has Lewy body dementia. He was diagnosed at the age of 58 about 8 years ago.
I'm the daughter of Florence Johnson. Florence has been attending the daycare here at the Council on Aging for 13 years.
My name is Roger, and this is my wife Elba, and we've been together for about 27 years now. And we're very lucky and fortunate to have been included in Osceola County of the Aging. It's been a real help for us.
He had gotten to the point where he hardly spoke because he was by himself a lot. So being in daycare and having people around him and talking all the time, he got very much more comfortable talking and saying things.
And it was brought to my attention by her managers over there at Disney. They saw that wasn't her because she worked there so many years. I knew something was going on.
Basically, at this point, he can't feed himself or go to the bathroom by himself or take care of himself at all. So all of that has gone on to me, and having daycare and having folks here that help him with that and that he's comfortable helping him with that makes all the difference in the world to me.
I never worried about her when she's here because I know she's well cared for. She is safe, she's secure, and they make her happy. I went to UCF and started taking classes because I know my mom was okay.
And it's really not easy seeing someone that you love and care for, somebody you've been with for such a long time, deteriorate the way it's happening. It's saying goodbye without leaving. In other words, I have her here physically, but mentally she's just, just leaving me.
And home on the weekends now, he'll be sitting on the couch with not all the attention that he gets while he's here because there are so many people. He'll sit on the couch and go, just take me home, take me home. And so he actually thinks this is home instead of home.
The daycare is the reason that I was able to keep her at home. And she loved the girls. She loves all these people. And I call them my angels. They're my angels. They watch over my mom.
Some people were telling me, well, why don't you just put her in a home and this and that. I said, I can't do that. I made a promise to her that when she was diagnosed with the disease, because she asked me, please don't put me in a home. So I said, no, I won't put you in a home. So, the Council on Aging, they've helped me with this commitment.
The Osceola Council on Aging is a godsend. All I can tell you is I love them. They mean the world to me. Take care of him.
Having hope propels us to achieve our dreams and drives us forward toward our pursuits. Hope is the light at the end of the tunnel, the radiant star by which we navigate our lives through trials and difficulties towards our dreams of a better day and a better life.
I was studying to be a CNA and a home health aide at TICO. I would have never made it to class on time without the transportation system here at the Osceola Council on Aging.
And I'm a student at TICO, currently completing my phlebotomy program. A big thank you, especially to the drivers. 6:15 every morning, they're there to take me to school. After school, they're there to take me home. It's awesome.
I came here for financial help, and Ms. Ramirez, Johanna Ramirez told me about the program, and she made a phone call, and luckily I was the last one to go for the interview, and I'm so blessed to be in this program.
I would not be here today, like I mentioned before, had I not had the transportation system. It's making a positive influence in me, definitely, because I'm able to continue my education and I feel positive and hopeful, and I don't just feel stuck in just one place.
Honestly, I was lost, and if I didn't have the help of Council on Aging, I won't know where I'm right now, maybe on the street.
It has helped me to balance and to help to see where I'm going to charter my life, because I'm now at the stage where I see that I can get a job and pay my bills and buy my food and look after my children. Yes, I'm at that stage in my life. Couldn't have done it without the help, so it's good.
The Council on Aging serves all generations and is a part of actively rebuilding the lives of homeless and disadvantaged individuals and their families throughout Osceola County.
I lost my job and I ended, like I told you, in different places, sleeping in couches and have my clothes in luggages or somewhere, and it wasn't pleasant for me.
I was working sometimes 40, 50 hours a week as an electrician for a top electrical company. And when the economy tanked, my job tanked. I got laid off.
I've got two disabled sisters who came to the point in their life where they were living on their disability checks as long as it would last through the month. And then when that ran out, they had no place to live, no food, no medicine.
And I did the best I could. I lived in this trailer. The floors were falling apart. I had to put plywood over the floors so it didn't fall through when I walked through.
Council on Aging was, I didn't even really know about it until I came in one day just to inquire about, was there any help out there? And they were unbelievable. They immediately contacted me and helped find housing for both sisters, and the one older sister, she's been approved for all kind of other services, and it's just been fantastic. What a huge blessing.
I only get a small amount of the Social Security, and I'm being able to feed my rent in there and have some money left over for other stuff that I need. Everything that you see over here, I got it from people that I guess love me and gave me this couch, the tables, the things that I have in the kitchen. And I'm happy. I'm very happy to be here. And I appreciate everything that is being done for me.
And I waited and I waited and I waited, and the day she called me was fantastic. And the first night I spent here, I had a good night's sleep for the first time. I mean, I had a nice, clean home. The bugs wouldn't bother me. I mean, and I thought, I'm in heaven. And I felt that, and it'd been years since I'd felt that feeling. So I'm very thankful for that. And, you know, I think there's a lot of good people out there that fall through the cracks.
Think about this. One day we're going to be in that position. We're going to be in a position where maybe we can't care for ourselves. And what would we want to happen? And because Council on Aging is there, that kind of fills in the gap. So, but the Council on Aging can't survive without me and without you donating and volunteering. So if you're listening to this right now, I encourage you to step up and find out what you can do. Even just a little bit helps and goes a very long way.
Hello, I'm Chris Hoagland. I'm the Adult Day Healthcare Director and Nursing Supervisor for the Osceola Council on Aging. And I'm here today to talk about the faces of our health clinic. We started a small primary health care center, and now we've grown into what we are today, with over 40 volunteering physicians that provided over 3,900 patient visits last year. Kenneth is a perfect example of one of those patients. Kenneth was a concrete finisher his whole life until age 57, where he developed severe arthritis, gout, and hypertension, and could no longer maintain a full-time position and lost his medical benefits. He turned to the Council on Aging, and for the past 7 years, Kenneth has been receiving free primary care at the Council on Aging. But in February, Kenneth made a doctor's appointment to see Dr. Sweeney due to a lesion that had been growing on his tongue for the past several months. Our physician determined that it was highly suspicious for cancer and that he needed immediate care by a specialty physician. Kenneth was enrolled in our Happy program, and he was referred to one of our volunteering physicians at Celebration Hospital. She determined that he needed a biopsy immediately, and Kenneth was diagnosed with an invasive squamous cell carcinoma, or a tongue cancer. He was then sent to one of our partnering cancer centers, where he had a partial tongue resection, or part of his tongue was removed, and he is now receiving treatment at that cancer center. Kenneth is one of our success stories, but there are so many more patients in Osceola County that don't have access to care. As a healthcare provider, to have to look our patients in the eye when they're at their most vulnerable, when they're scared and they have nowhere to turn, and tell them there's not enough dollars to help them. It's a very hard thing to do. So today, as a nurse, as a member of this community, I'm asking you to help. As our theme song says at the Council on Aging, what are we waiting for? Let's take a stand. Let's make sure that people like Kenneth don't fall through the cracks. We can reach out and join hands, and as a community, make a difference. And you can help us continue to save lives and make a difference every day.
Hello, my name is Darlene Vega, and I am the Meals on Wheels Assessment Coordinator here at the Osceola Council on Aging.
And so I called Darlene up, and she said, yes, I'll come and talk to you.
We're getting a lot of calls about young people just like the rest of us, working with families, and now, because of a disability or an unforeseen circumstance, now they're in desperate need.
I was an iron worker. I set all the red steel, the columns, bolted the beams in, and I was a connector. I had to walk around the cable that was holding the beam up. It wasn't work. It was fun. It was play. Yeah, one happened in 2004, a motorcycle accident, and in 2008, I had the tumors. in my head. I just don't know what to say, but I wish I was still working that. It's not that I'm lazy or anything. He said, you'll never be able to do ironwork again. And I was devastated, man. It was like, wow.
The program is incredible on a daily basis. Not only do they get a meal, it's so much more than a meal. It's a well check, it's a friendly face. So many of these people face isolation, and they just need someone to let them know, I'm here, you know, I'm checking on you. Makes them feel like they still matter.
I'd eat every 2 or 3 days. I used to wrestle, so I was used to going a couple of days without eating. I mean, I'm up waiting for them to bring me my food, but it's so wonderful to have people that donate their time, and they're just a family, you know. I'm one that really enjoys the food, the service, bring it right in, set it on my table. They all knew, I know them. Hey, Rich, what's up? I said, what's up, Rich?
So many, you know, we've gone to deliver a meal, and at times found them that they're in need of medical assistance, 911. If it wasn't for that person delivering that meal, these people would probably pass away in their home. Many of them fall, many of them, they're diabetics, and if they have not taken their insulin, some of them are on the floor, and we had actually one person that was almost in a coma by the time the volunteer found them. So this program is vital, and it is a matter of life and death for them.
It's really been a blessing to have this for me, you know, provided for me.
A lot of times I often wonder the people that I do have to place on a waiting list. I always wonder, you know, what happens next. By the time we have enough funding to be able to assist them, sometimes it's too late.
The Osceola Council on Aging is dedicated to providing services to enable independence and self-sufficiency for seniors, disabled adults, the disadvantaged, and families in poverty. The face of need. So special, so dear.